Healthcare reform, the expected impact on the middle class. Basically, President-elect Obama had requested input by December 31st, 2008. And here's my input. You asked for it, you got it. So when we're talking about healthcare, or anything for that matter, it helps to try and establish a foundation of common understanding. So what I'm going to throw out there is, healthcare is a good or a service produced by people. Pretty self-explanatory, self-evident. Again, healthcare is consumed by people also, at least the healthcare we're talking about. Therefore, healthcare is simply another item produced in our economy that reacts to changes in supply and demand like many other products do. This is because people are involved and supply and demand works in accordance with human nature. Another thing we need to clarify is, which market are we talking about? Now, I've taken the healthcare industry and split it into three major markets. First market is composed of the super rich self-insured people like Britney Spears, Robin Williams, etc., who basically have enough money whenever they want that they can simply write a check for whatever procedure they want. So these people, again, they don't need insurance or anything. They have the wealth at their command, and the channel of health, the channel that they get their health care from, goes up to and includes specialty clinics. So you can fly out to Scottsdale and get a tummy tuck, a nose job, etc. You can go to the Betty Ford Clinic and write a check for it. They're up there in the rare air. Not most of us are there. Another market that I've defined is really the consumer is insured, basically the middle class. This is by far the largest market out there. This is the market that I'm part of. So I get my health care through my primary care physician, hospitals, etc. Basically what we consider to be the normal markets or the normal means of healthcare delivery. There's a third group, also uninsured, but for a different reason. We like to call these people lower income, although it's not clear that that's the case. There's a lot of reasons people are uninsured. Sometimes they're just young and they think they're going to live forever. But their channel for receiving health care really is restricted to the emergency rooms, free clinics, etc. Now, it's important to remember that if they go to an emergency room and need a specialist, they will get to see a doctor in a hospital. So really everybody already has health care. But anyway, so talking about the three different markets, nobody's really concerned about Britney Spears and the market that she operates in. And I'm sure she's not concerned about healthcare reform either. So we're really not going to discuss this market. What's really of interest, though, is this middle market, the normal channels of healthcare providing. Because really what the healthcare reform goal is trying to do is to move those people in the uninsured or lower income bucket to give them the ability to use the channels of healthcare that we call normal channels, the primary care physicians, hospitals, etc. So the question is, what's going to happen in this market? Well, let's look at supply and demand, and what does that tell us will happen? So here's a typical supply and demand chart with prices going up and quantity demanded going out to the right. Have a supply curve that simply shows as prices go up, the suppliers like to produce more of any good or service. A demand curve that shows as prices go down, people like to buy more of any good or service. So I actually have another presentation on supply and demand. If anybody wants to go look at it, that's fine. So where the two lines intersect, the market is in equilibrium. There is no signal being sent to either increase capacity or take capacity away, etc. So everything is sort of stable. So what happens when the subsidization of the insurance starts? Well, really what's happening is more people will enter the market, which is what the government wants to happen. So the demand is actually going to shift out. Okay? This is important to remember. The demand increases, but there's been no movement in the supply curve if all we're doing is subsidizing insurance. So, in the short run, the prices won't respond immediately. So what we're going to experience is, at the current prices, there's going to be shortages. The quantity demanded is greater than the quantity supplied. Look along the lower axis. This is the classic definition of a shortage. That's what the people in this market will experience. Now, those of us that were already in the market, we're not going to like this because we have not been experiencing shortages. The people that were in the uninsured group, this isn't going to be any big deal to them because they're used to dealing with this kind of stuff. In the long run, if the prices are not allowed to move, these shortages will become chronic. In fact, it's not uncommon at times in other countries where they've tried to reform healthcare or nationalize it for people to die while they're waiting for procedures. So that's what happens when you have chronic shortages. However, in the long run, what's more likely to happen is prices will adjust. And guess which way they're going to go? They're going to go up. It's very difficult to stop a market from reaching equilibrium. So that's probably what's going to happen. So, what is the group of people that were already in this market going to experience? All they're going to see is an increase in prices. Now, the people that were uninsured, they're going to see a little bit of an improvement in their health care because they're now going to have access to the hospitals, etc. But those of us that are already in the market, the only thing we're going to see is increased prices. Now, if we're currently in a situation of excess capacity, things aren't so bad. Because when you shift the demand curve out, the prices will stay stable and the quantity supply and the quantity demand will actually reach equilibrium. So that's not too bad. The question is, are we in an environment with excess capacity? If we are, we would have been seeing decreasing costs or decreasing prices. I don't know about you, that isn't what I've been seeing out there in the market. Another option would be, what if we did something to increase supply? If you increase supply, then a lot of good things happen, right? Our chart shows that the prices go down at the same time the quantity supplied increases. Those are two good things, especially if you want more healthcare. Then, if we want to increase demand even further by subsidizing, or whatever we want to do, if we're lucky, very lucky, when we increase demand, the price will go up, as it will, but we'll reach back to where we started. So at this point, we actually have even more quantity supplied, and the prices have stayed the same. But the key here is to increase the supply first. Now, what you're probably going to hear in these conversations is there's something else the government's going to do to increase supply at the same time they increase demand. Be very careful about that and make sure that there is true linkage between the two. There's probably no reason we couldn't do the supply, increase supply first. So finally, basic economics allows us to predict the probable outcome of subsidizing health insurance. It's really, or probably, only going to increase demand further, causing more shortages and increasing prices among that middle group of people that already has insurance and is already in the market. Meaningful healthcare reform would focus on increasing supply, not demand, or at least increasing supply before we go out there and try and increase demand. There's one thing that we should have learned in the last few months. It's the danger of distorting the markets. Look what happened when we got in there and tried to make the housing market more efficient. I hope you've enjoyed this presentation on the proposed healthcare reform.